Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Let's look into the drug regularity schedule, and this is as per the 1940, that is the 2016 update. So the first one is the Schedule C. The Schedule C, it refers to the biological and other special products. Example, the toxins, insulin, as well as the sera and the antibiotics. Next is D. D stands for the list of drugs exempted from the provision of import. So it is exempted from the provision of import. Then moving on to the F. F is where there is a blood and the blood products are, it is related to this. So there is a F1, which is the production of the bacteria vaccines. Then comes the F2. F2 is specific of standard for the surgical dressing. Then comes F3. F3 is for the specified standard of ophthalmic preparation. So it's not F3, it is known as the FF. This is for the ophthalmic standards. Next is the G. The G is with the labeled caution and dangerous to use except under the medical supervision. So it is medical supervision, or it can be, it is cautions, or else it will be dangerous. Now looking at H, H is nothing but the prescription drugs. And what about J? The J is a list of drugs that a drug may not be able to prevent or cure. So there is no cure for this. The example can be HIV or the atherosclerosis. So what about M? M is where the regulations regarding the good manufacturing process. So M for the manufacturing practices. Then looking at P, P is where the regulations regarding the life period and the storage of various drugs. So the regulation of life period and the storage of various drugs. Then comes W. The W is the drugs marketed under the generic names. And looking at the Schedule X, X is where the drugs having the abuse and dependence liability. What about Y? Y is where the requirement and guidelines for the import and manufacturing or the clinical trials in India. To learn and grow daily like this, please do subscribe.